Of the 35, we have 31 positive, we have 1 negative, and we have 3 inconclusive results. So again, that's 35 total tests. 31 of our residents in those tests have tested positive for the coronavirus.
Now, we know that every person living inside the Kirkland Center has been tested, but the staff is still waiting for tests of their own. Tonight, Q13's Frankie Thompson reports on how those working inside the facility are maintaining a supportive atmosphere.
Well, when I heard that, their nurse was hospitalized, I thought, wow, somebody needs to pick up where she left off and continue the delivery of care. And I knew right away I wanted to come here and try to make a difference.
A difference Kathleen Lombard volunteered for to help save lives from the COVID-19 outbreak at Life Care Center of Kirkland. As another resident with symptoms is taken to a hospital, Lombard says patients are getting the care they deserve with the help of at least 30 nurses, nurse practitioners, and doctors sent by the U.S. Department of Health.
Things are really looking up with this added help that have come in, these nurses and doctors to work with us.
5 employees have also returned from home quarantine, while several others are waiting to get tested. More supplies are dropped off to help protect people from the outbreak, but a spokesperson says what they're waiting for are more test kits for quarantine staff.
We continue to ask for support in that regard. The kits are the number one thing. Test results are weighing on us. That's something we'd really like to see.
The spokesperson says local, state, and federal agencies have not given a timeline when those tests will be available for the rest of the staff. He says at least some are healthy again to get back on the job.
The 5 employees who came back were anxious to come back and help. So again, heroes within this facility, running into the fire, as it were.
In the fire with them are people like Lombard to assure loved ones of residents are getting the care they need.
Think of yourself if you were in a room all day and you couldn't come out. So I go in and sometimes we tell a quick joke, anything to cheer them up. I ask a lot of them what kind of work they used to do while I'm giving care, just to learn a little more about them, to have something for them to talk about.